Thank you, Chair. My question is just about how all this ties together across the NHS and social care. We talk often, especially today, about the compensation to families, but obviously the lifetime, especially for babies and children who have been severely disabled, that's going to affect their life for decades to come. The cost to the system of that is immense as well. And I just wonder whether there's been any economic assessment of the cost to the NHS and social care for when failings happen, and also how that's factored into putting a similar amount into prevention so that these things don't happen in the first place. Because obviously when we talk about figures like millions being used through compensation, obviously that's essential for the family, but of course there's underlying cost there as well.
Absolutely, and yes, there has, and I am probably not the best person to talk about the detailed economic analysis. I'm afraid I'm not an economist, but certainly, I mean, I think the one thing that is incredibly clear is that harm prevention, reducing numbers down to the bare minimum, is by far and away the most effective option and use of money that we could do. And I think we're very clear that Sweden's rates are far lower than ours. So this can be done. But I think in terms of prioritising the cost-benefit analysis of each of the interventions, I'm afraid that's more detailed economics than I'm capable of.
Thank you. No, thank you. I'm just very interested to know whether, as well, forgive the question to you if you don't know the answer, no problem. But it's just around whether these costs are looked at both from the NHS and the social care side of things, because you know, a lot of support is given at home and through care outside of hospitals and GP surgeries.
Sorry, please go ahead, Sonia.
Sorry. The other thing that I would say is we have international comparators as well. So I mean, I think we look here at what we do, but we also need to look to other international comparators, because there are birth injury compensation funds in the United States. There's one in Florida, there's one in Virginia. There are schemes like the Swedish scheme, and there are schemes like the Accident Compensation Corporation in New Zealand. And each of those have different balances of providing social care provision, providing nursing care, providing healthcare, home adaptations and things like that. So it's not like we are the only place that we can look to. We can look outside the UK. But as I say, it is far more nuanced and detailed economics than I do, I'm afraid.
Sure. No, thank you very much.